Okay, we are going to start now. My name is Lionel Bopage. As one of the co-conveners of the Voice of Democracy in Sri Lanka International Collective, it is my pleasure to welcome you and to thank you for taking the time to attend. Firstly, let me acknowledge the traditional owners of Australia, the first people of this land, from where we are conducting this webinar today. We pay our respects to their elders, past and present, and the elders of other First Nation communities. At the macro level, the society of Sri Lanka has been in continual stress, be it due to natural disasters, conflicts, and civil wars, social inequity, and discrimination. This situation is compounded with the spread of COVID-19. Anybody walking the streets of our verdant isle cannot but notice this decades-long trauma. I am no stranger to imprisonment, torture, and trauma. In addition, I was involved in providing holistic mental health services to hundreds of torture and trauma victims when I was resident in Canberra. Due to the limited mental health understanding and stigma prevalent in our cultures, and the lack of mental health resources, psychiatric illnesses mostly remain unrecognized. That is why it is important for people of goodwill, secular or religious, to have opportunities to alleviate their trauma. All short-term measures need be accompanied by long-term measures to rebuild their lives by providing the essential mental health services. Hence, the need for this aptly named seminar, Traumatized by Invisible Wounds, the case of Sri Lanka. Professor Somasunderam, our distinguished moderator, is Chair and Head, Department of Psychiatry, School of Clinical Sciences, Monash University. Director of Research, Mental Health Program, Monash Health, and also Director of Research, Cabrini Asylum Seeker and Refugee Health Hub, Cabrini Outreach in Melbourne, Australia. He is of Sri Lankan heritage, involved in peace building and reconciliation work, and is well known in the medical profession in Victoria. He has been involved for 17 years in asylum seeker mental health. He is an expert consultant on asylum seeker and refugee mental health to the UNHCR and has provided similar expert advice to the United Nations Commission on Human Rights, Australian Human Rights Commission, Australian Department of Home Affairs, US State Department, the governments of Papua New Guinea, Republic of Nauru and Sri Lanka, and numerous non-governmental organizations. He has established pro bono health services for asylum seekers, most recently with Cabrini, the Cabrini Asylum Seeker and Refugee Health Hub, providing primary care and specialist mental health services in the state of Victoria. He has also published and presented nationally and internationally his research work in the mental health of asylum seekers and refugees with multiple national and international collaborators. I also take this opportunity to thank him for being the moderator of this webinar. Without much ado, let me invite Professor Somasunderam to take charge. Thank you.
Thank you, Lionel, for those kind words. It's a great honour and a great privilege to be able to moderate such an important discussion as we hope to have this evening. Welcome to all the attendees and welcome to all of those who might listen in at a later time. At this particular juncture in the history of the world, to moderate such an important discussion as we face all of those difficulties, I think it's opportune for us to have such distinguished speakers as Dr. Mahesh Rajasuriya and Professor Daya Somasunderam present to us their work. The way that the evening, certainly in Melbourne at this point in time, but the way that this session will unfold is that I will allow Dr. Rajasuriya first to present, and then immediately after Professor Somasunderam, and then each of those speakers will speak for about 25 minutes or so. We'll then have an opportunity for questions and then for a more broad-ranging discussion. The session will last in total 2 hours, and I will ask the speakers to keep to time to allow sufficient time at the end for appropriate questions and discussion. So without further ado, I'd like to introduce Dr. Mahesh Rajasuriya. Dr. Rajasuriya is a senior lecturer at the Department of Psychiatry, Faculty of Medicine, University of Colombo, and he's a consultant psychiatrist at the University Psychiatry Unit at the National Hospital of Sri Lanka in Colombo. He's a member of the Expert Committee on Tobacco, Alcohol and Illicit Drugs of the Sri Lankan Medical Association, and the founding director of the Centre for Combating Tobacco at the Faculty of Medicine, University of Colombo, and the chairman of the Alcohol and Drug Information Centre. He's also vice patron in Sri Lanka. We're very privileged to have Dr. Rajasuriya present, and I welcome him to give his presentation today. Thank you.
Thank you, Suresh, for those kind words of introduction. Yes, let's get on with what I have to present to you. Let me get my slides up first. Yeah, okay. So my topic is a holistic approach towards negative mental health impacts. What I intend to talk about, or what I intend to present to you, is my understanding of negative mental health impacts rather than a holistic approach to deal with them. Because I believe that all of us, we need to get together to design this holistic approach. It's no easy task that one person can do. So I would share my understanding of the negative mental health impacts, which might be different from yours, which hopefully would form the basis for a holistic approach, or perhaps it will give rise to a discussion, analysis by you, all of you, and others as well. And then the discussion ensues will perhaps pave the way for a design of a more holistic approach. I think that's the idea of this whole webinar. It's not really an academic understanding of the negative mental health impacts as I see them. And my approach to this is like this. I'm going to first list the negative mental health impacts in current times, not necessarily during COVID pandemic time. Then once I list at least some of the important mental health impacts, let's look at how the COVID pandemic has changed them, or shaped them, or morphed them into a different form. So this is my list of negative mental health impacts, which I'm going to share with you in a minute. So don't worry, I'll come back to this list. But I mean, this list is the negative mental health impacts throughout maybe the last few decades, not necessarily during the last 2 years. But I think I need to speak a few words about the COVID pandemic-induced or COVID pandemic-associated specific impacts. For an example, the fear, the anxiety about COVID, the anxiety about getting COVID, the anxiety about being the way you're going to be treated once you get COVID infection, and what might happen once you recover and come home, and so on and so forth. I'm not going to spend a lot of time on that. What I see is that, this fear, this anxiety, which is quite normal about any major stress or pandemic, it shows a pendulous, movement, a deviation. Now, what I'm trying to say is that, you become, the entire society become, not only society, perhaps the government, the health authorities, and everyone, suddenly, for whatever reason, actual, perceived, or created, the anxiety level suddenly goes very up. So the fear is very high, right? And this, and we do all sorts of, very cautious things. We are very, very careful. We take extreme measures, and then this pendulum swings to the other end, where we are, extremely careless and putting ourselves in danger. And then something happens, and then this pendulum swings again back to the other end. So this extreme wild swing of this pendulum of COVID fear is creating lots of problems. And then dying with COVID. I mean, we know that we all will have to die one day. COVID is one thing that might take your life. But dying with COVID is very tragic and sad. I mean, you are isolated, you are, sometimes not even frequently cared for by a health worker, and the health workers are in spacesuits. You are in a different world. You can't even talk to your loved ones, and that's how you die. So that's a very sad way to die. So people are aware of this, and that plays in the minds of people. I think some of these observations can explain certain behaviors that we see, and we just keep on blaming people. I think we need to understand them a little bit more and more in a deeper way. And the impact on the general health care because of COVID related anxieties and, commitment to that, the general health care, the care for the people with diabetes, mental health issues, the clinics, the general practice, and these are severely affected. And I don't know whether more people die because of that rather than COVID infection. And then the financial status of individual families, communities, and entire countries have suffered seriously, and in a disparate way. If you, I'm not going to talk a lot about that, but if you do a little bit of research, you would find out that the leading the billionaires in US has increased their wealth by about 50% during last 2 years, while the rest of the world had suffered and unemployment skyrockets. Right? So it's something worth paying attention to, how the financial impacts of COVID have affected people and families and communities and countries in different ways. Right, so this is my list of all time in the sense, current, the last few decades that affect Sri Lanka. Perhaps these are relevant to other countries as well. But before going into these issues, let me quickly tell you how I compiled this list, the methodology of doing it. So I looked at mental health impacts, which are current, relevant, and important. For that, I mean, this is my view of current mental health impacts, relevant mental health impacts, and important mental health impacts. And you may differ, and that's perfectly all right, and we can discuss about that. I see a significant cross-section of the society, the very affluent VIPs, powerful ones, and the lowest rung of the society. I see patients in the government hospital, the private practice. So I see a fairly good cross-section of the society, and that is a source of information. And then I talk to people. I meet so many people, and I talk to people specifically to find out the main mental health impacts which are current and relevant and important. And of course, the evidence base, and not a lot of research has been done on Sri Lanka about the mental health impacts. So this is my list of issues that I'm going to quickly take you through today, and we can discuss about them later. So first and foremost, there may be a bias that I particularly think that this is very, very important. But anyway, so the first thing I want to mention is anti-child developmental primary and secondary education system in Sri Lanka, especially the primary. The objective that you can't do away with in education is, especially primary education, is facilitating child development. And if you can't do that, then there's no point in having that education system. Sri Lankan education system has many things to boast about, being free education and all that, but unfortunately, the primary, especially the primary education, is quite not child-friendly. It's anti-child developmental, mainly because of the amount of the curriculum. It's huge, and it's a huge stress on the teachers to cover this. And they resort to all sorts of measures. For an example, getting parents to fill in. I mean, they say, you know, this particular thing lacks in your child, and shame the parents in front of other parents, shame the kids in front of other kids. So the parents will somehow drill that into the child. And obviously, parents are not professional teachers or teachers at all, and they would use they may use very harmful methods. And the burden is, the amount is so big, so they can't wait and do it, patiently. So this gives rise to many issues. I mean, I see so many children and adolescents because of these issues, and they suffer, and they do not have a proper childhood. They become, quite problematic in their personal development, and not assertive, passive. I mean, the education system tries to create obedient children. That is the motto of our education, unwritten motto, it's obedient, it's passive children that they try to produce. And teachers in Sri Lanka are unfortunately untrained or unprofessional. I mean, Sri Lanka produces very good doctors. There's a high demand for doctors all over the world, for Sri Lankan doctors. These doctors are trained for minimum 5 years, and there's a 1-year internship. And even after that, not everybody works independently. You spend some time under supervision and so on and so forth. So, I mean, it's a very professional product that in the end we release to the system. But in the education system, these teachers have hardly had any meaningful training, let alone any professional qualification. So they are also handicapped. We can't just go on blaming them. They don't know how to do it. They don't understand the principles of child development and how to facilitate it, and what happens if not. So it's a terrible situation, I would say, that we need to do something about it. Okay, now what has happened with the COVID pandemic? Well, paradoxically, the suffering of children may have become less because there are no schools, so and huge workloads cannot be expected to be completed during these lockdowns and online sessions and all that. All teachers, students can be flocked into one classroom and given huge tasks and a huge amount of homework, and check next day if not done, punished, and these things don't happen anymore. So perhaps the burden is less on children. However, the whole education system is disrupted because of this, again the disparity comes here. The affluent will have access to online classes or alternative teaching and so on and so forth, and in the poor or in the rural areas, they don't have mobile signals, they do not have access to online stuff, online classes. They may not even have a smartphone, forget about a laptop. So there's a lot of disparity during the COVID pandemic times. of the burden of education disruption for children and for families, which give rise to enormous worries and fears and actual negative impacts in future, most likely during these times. Next issue is power-based interpersonal interactions in Sri Lanka. How people relate to each other depends largely on the power base or the power the other person draws. And again, children suffer because of this. I'll give you an example. I was at one of these outlets before COVID times at a school event on the school ground. There's a little this temporary shed which sells food items. So of course there are a lot of people to buy food items during break. So I was watching from a distance, and there were maybe 10-15 people, many adults and few children. And of course, in the Sri Lankan way, there's no queue. They were just at the counter, and the children were being towered over by the adults, getting their hands and asking for this and that. And what I really observed was that the assistant there who was doing the sales was paying attention to the adults, especially the adult with the largest mouth. The children were neglected. Children were waiting, especially the smallest children. They had to wait a long time to get what they wanted. So children are, because children have little power, so nobody pays attention to them. Nobody cares to listen to them. What can they do? They have to listen, right? They don't have to talk. We don't have to listen to them. So this power is not only children, it's it may be you are being poor, or you are from a particular class or ethnicity or whatever. The power-based interpersonal interaction is, and especially the job, when you go to some place to get your vehicle registered or whatever, insurance renewed or whatever. The first thing generally, if you observe carefully in Sri Lanka, what you see is that the person goes and says that I'm a doctor from this hospital, I'm a lawyer, I work at this particular office, that is perfect. That's completely relevant to the task that you're going to get done. That is because you are showing your power base, and because that will immediately change the response of the clerk there. So this power-based interpersonal interaction causing immense pressure. You and I, we have access to internet, we have smartphones, we are fairly powerful persons. We don't feel this, but it's the common man, the common woman, and children who feel this. I think this has some relevance to the poor road discipline that is seen in Sri Lanka. Perhaps better than India or whatever other countries, but the road discipline is not acceptable at an acceptable level. Again, the powerful, the one who has or who believes he has more power, cuts off the other person, doesn't care for the rules, and that's what's happening. So these are another current issue that I want to share with you, and perhaps I might also tell you that it's a different way of me looking at these issues rather than the list of issues that is important, the way of looking at it. So during COVID pandemic times, the suffering due to COVID is also related to the power base. So the more powerful ones can get things done and treatment obtained and go to the better hospital and so on and so forth. And in vaccination as well, you can see what has happened on media, what you have seen. But having said that, I have to say that in many centers, the vaccination happened properly in an organized manner, and the due credit should be given to the organizers of these places. Quickly, the other issues, existence of subhuman layers in the society. For an example, the incarcerated. This happens, I think most of these issues do apply to other countries as well. But I'm talking about the Sri Lankan setting. For an example, the incarcerated, the people who are in the remand prison or the prison. They are not human, they are a subhuman. They are in a subhuman layer. Now, when the COVID restrictions started, the first to go were the visitation rights of the prisoners, right? I mean, and there can be remand prisoners who may have been remanded for no fault of theirs, and the courts are on vacation and they're in remand, and visitation is cancelled. I mean, we forget certain layers of the society when we make decisions. We don't see them. Children also sometimes come into this layer. And cleaners that we see all the time on the roads, most of them are, having disabilities, because these downtrodden people are pushed to these jobs, and they have to settle down to a subhuman existence. This is something that we need to seriously look at, all of us. We might not notice it because it doesn't come our way often. Okay, during COVID pandemic times, as I mentioned before, visitors to prisoners have been cancelled, and now there's a discourse on the effectiveness of the lockdown, which is a very, very technical discussion, which I do not want to go into. Within this discussion, the issue is raised about the impact of lockdown on the economy, the tourism, this and that, but hardly people talk about the impact on the common, powerless, poor person. They do not exist in this equation, right? We have access to the phone and the internet, and we can order things and they come to the door and we pay by credit card. There are houses where they don't even have a smartphone, and the nearest store is so far away and they are not allowed to leave the house. And how do they survive? There must be so many families starving during lockdown, and we do not consider that in the equation of making the decision. The alcohol, tobacco, heroin, cannabis trap. I call it a trap because people are trapped into this. I'm not talking about the one who occasionally uses it, but but I'm talking about other psychological, being trapped in a psychological manner. The norms created with the help of creative work, the social media, movies, novels, and all that. The norms created to celebrate every time you need to have alcohol. And, being with family is less important than having a long drinking session with friends every night, again and again. And then people learn this learned helplessness. The wives, they become disempowered. They no longer have any ability to change the situation at home. So these are very, very sad situations. And during COVID pandemic time, an interesting thing has happened. Right now, currently in Sri Lanka, all alcohol sale points are closed, shut down by government, which is a very good decision as far as COVID control is concerned. But the side effect result of that is that, there's no availability, there's a severe restriction on the availability of alcohol. And we see, in the first wave, ADIC did a study and found out that up to 50% of people have completely stopped using alcohol, and there's a significant reduction in use of alcohol and other substances during the first lockdown, where again now the alcohol sale points were closed down. And now probably it's happening again. We don't have the data as yet, but from patient feedback, people who come to see me, clients and their families, I can see that many people have stopped or reduced alcohol use, which have given rise to very appealing and satisfying positive outcomes in their families. And we can use perhaps, and I have seen it's already happening, the dawning of the insight. So suddenly the family, the wife, and perhaps the user himself suddenly realizes, my goodness, I can survive without these substances. It's not that I have to drink every Friday with my friends and come very home late, drunk, and driving my car with a lot of risks. You don't have to do that. You can live without it. I'm not talking about becoming a teetotaler, but you don't have to be a slave to it. So that insight is perhaps dawning in families and users. Perhaps we have a duty to help people to realize that more, so they can learn lessons which they can apply when the availability is restored. Okay, I think I will have to quickly go through them, but Suresh, you can stop me at any time if I'm going beyond my time allocation, because I have perhaps already made my point, sharing my way of looking at negative health impacts. So if time is a constraint, I can stop at any time.
Lovely. Thank you, Mahesh. Maybe a couple of minutes. If you wanted to finish up in a couple of minutes, would be great.
Thank you. The high level of cumulative residual stress. The residual stress is a term found in solid matters and engineering and mechanical engineering, but I have used it within quotation marks. Residual stress means the stress it's not a great stress, it's not a big issue, but you tend to accumulate one after another and another and another. At the end of the day, it's significant. For an example, you get up in the morning and you have to drive along, you have to travel for 2 hours to get to your office. But you do that, but you don't think it's a great big deal, but it starts accumulating, and when you come back, it's another long hour, and it's very humid and you are uncomfortable. And when in the public transport, it's so much congestion, and there's a lot of noise, right? Thankfully, it's less in Sri Lanka now. So all these contribute to some, stress level accumulating in yourself without your knowledge, which I call residual stress, and that is a significant problem in Sri Lanka, which affects our performance, our productivity, and our mental health, which is minimal in a well-organized country like Australia or UK. During the COVID pandemic time, it is actually much less because people hardly travel. A lot of the residual stress is taken away, but new stresses have set in. Sixth one, the judgmental view of adherence to norms. Unfortunately, the culture of Sri Lanka, currently is such that I don't think that was what was happening in the early days. People are very judgmental, and you have norms that you need to fill in. You have to act a certain role. You have to be the perfect wife or the perfect husband or the perfect son. And people are very quick to judge and very poor tolerance of deviation. And this again, I think, affect road discipline as well. If you are a 3-wheeler driver, or if you are a tuk-tuk driver, you have to cut across people and drive like this. Otherwise, you are not a real. If you're a private bus owner, you have to drive as if this is your last trip. These are norms and which people try to live up to, and you're forced to do it. I think COVID pandemic has added new norms, like getting COVID is a crime, and people have been labeled, false rumors spread and so on, saying that they had secret lovers, a series of secret lovers. That's why they got COVID and all that, so lots of judgmental views that we see. Shame, guilt, and self-blame. There's a big anti-Sri Lankan sentiment, especially in the youth. There are so many things to appreciate and admire about Sri Lanka, but everything is negative. Just because it's Sri Lanka, it's all bad. You're just ashamed or guilty and blaming yourself just because you're a Sri Lankan. There are many elements that drive these kinds of sentiments, but we have to be aware of them. I don't know the impact of the COVID pandemic on this. I think we have to wait and see. Last but not least, the mental illnesses. I think it's the prevalence in Sri Lanka. We don't have very rich data. Is not greatly different from other countries. Perhaps the whatever data that we have says that it's not greatly different. But about the military and the PTSD, because my colleagues have done a research on that, have found that the PTSD prevalence in Sri Lankan military is much less than PTSD levels in US and UK military. Much less, quite less. We can discuss why it is so. We can speculate. But I think generally the mental illness burden is more or less same. And during the COVID pandemic, I'm not sure how much it has changed. You have to wait and see. But the substance use availability has reduced. Perhaps it has created some positive outcomes. So that is the list. It's not a comprehensive list. It's perhaps an attempt to tell you the way I look at it, or a different way of looking at negative mental health impacts. And thank you very much.
Lovely. Thank you, Mahesh. That was a comprehensive and sophisticated look at the impacts of COVID-19 on the Sri Lankan population. There are quite a number of comments and questions that have brewed during that time. As I said, we'll leave them for the discussion and the questions after our second speaker. So I'd like to now introduce our second speaker, Professor Daya Somasunderam. Professor Somasunderam was a senior professor of at the Faculty of Medicine, University of Jaffna, and a consultant psychiatrist working in northern Sri Lanka for over 3 decades during the time of the conflict there. He's also worked as a consultant psychiatrist here in Australia, in particular at Gladstone in South Australia, as well as supporting those refugees and asylum seekers from all over the world who've come to Australia, working through the survivors of torture and trauma and assistance and rehabilitation service in Adelaide. Professor Somasunderam is also a clinical associate professor at the University of Adelaide, and recently anyway has been working as a consultant psychiatrist at the Wide Bay Mental Health Services up in sunny Hervey Bay in Queensland. He previously has worked for a couple of years in Cambodia in a community mental health program with the Transcultural Psychiatry, a psychosocial organisation. He's been a co-chair of the subcommittee on PTSD that was formed under the WHO Working Group on Stress-Related Disorders during the ICD-11 revision process. And apart from teaching and training a variety of staff and community-level workers, his research and publications, many books in fact, have concentrated on the psychological effects of disaster, both man-made wars and natural disasters such as the tsunami in 2004, and how one treats such effects. As I mentioned, he's written a couple of books, including The Broken Palmyra, The Tamil Crisis in Sri Lanka, which is an inside account. His book, Scarred Minds, The Psychological Impact of War in Sri Lankan Tamils, describe the effects of the war on those communities and the psychosocial consequences of disaster at the community level. He's functioned in a number of national co-chair of the Task Force on Psychosocial Support and the Office for National Unity and Reconciliation, and on the UN-mandated consultation task force on reconciliation mechanisms in Sri Lanka. He comes to us with really a wide and distinguished history of writing and research on the effects of trauma on populations and on the community. So it's a great pleasure for me to invite Professor Somasunderam to give his presentation this evening. Thank you.
Thank you very much, Suresh, for your introduction. And I'd also like to thank Lylan and the Voice of Democracy for giving me this opportunity to share some of my thoughts and recommendations. I think because of the limitations of time, I may not be able to cover the whole area of disasters, but generally the principles are the same. So I will be mainly talking about the COVID situation now, which is much more critical. And if there are any questions or discussion, we can go on to that in the discussion time. So just a few points about the disasters before I go into what's happening from a Sri Lankan perspective. Internationally, disasters almost happen every day, although currently the COVID pandemic has taken precedence and is raging in many parts of the world. So you look at that, the statistics from the International Federation of the Red Cross is quite worrying, and you see so many people are affected, people are displaced, there are a lot of destruction, communities are displaced to camps, and then people have to recover and rebuild their lives. Earlier, many of these disasters were divided into natural and man-made disasters, or synthetic or technological accidents, and so on. But there's been a change in the pattern, and more recently, due to weather and climate change, have begun to predominate, which has been observed in by the many international organizations. And I think that's a worrying factor, and maybe we need to make more policies and be prepared, and maybe change our ways. And this earlier distinction between natural and man-made or synthetic is also now becoming vague because we find that man somehow involved or responsible, maybe not directly, but indirectly, and they seem to be overlapping. So man-made conditions can lead to natural disasters, or for example, some of the weather changes we see can be due to what man has done. For example, what's happening now with this cargo ship that was burning and now is sinking may create an ecological disaster, unprecedented in Sri Lanka. When we look at disasters generally, the type of impact that it has psychologically, there are many similarities. Of course, there's a lot of difference depending on the severity and the type and so on. We have certain well-recognized reactions from understandable distress to a catastrophic event to coping, that is adaptive and maladaptive. And beyond that, you can get some well-recognized psychiatric disorders like PTSD or depression, anxiety, alcohol and drug use, which become quite maladaptive and may need treatment. But by large, people cope and somehow make do and recover. So we may need to look at the coping mechanisms that people use in these kind of situations. So coming back to the pressing situation now, the COVID pandemic, which has affected almost every country in the world. Some countries much more than others. And we can see all the statistics with so many people getting the infection, many dying, but there have been also many who have recovered. Many countries who have been able to adapt strategies to contain the spread, and there have been a lot of positive effects also. So apart from all the deaths and the suffering, people have also learned to behave, and there's also a sort of coming together, although there are restrictions on travel and countries have put hard borders, isolations. It's been also a global, because it's a global phenomena affecting everybody. There's been a coming together, particularly maybe through the social media and the internet. And people have learned also about infections, about vaccines, So there is also both positive and negative aspects to the COVID, which we may need to look at when we are looking at the response. But it has been a challenge to individuals, to the families and communities, and into international relations also. Till quite recent, maybe a few months ago, Sri Lanka was doing reasonably well. It seemed to have contained the virus, particularly the public health measures. Sri Lanka has a very strong public health sector. The family health workers, the PHIs, the MOHs, well experienced in tackling conditions like malaria, dengue, and in the past, various infections that have come our way. But unfortunately, I think we may have become a little complacent, let our guard down, and we can see what has happened in Sri Lanka. If you look at the curve, somewhere around April, it seems to have taken up. So it may have been something to do with the New Year celebrations that might have been a super spreading. That's what many authorities are suggesting, and things have really got out of sort of hand. Hopefully, as we go along, we can sort of get this under control. There can be some flattening of the curve, and particularly if the vaccination rollout is successful, we may be able to get some kind of herd immunity, so many people vaccinated, and then this virus may not spread. Unfortunately, there are also these variants now coming up, and there is some worry that some of these variants may be resistant, or the vaccines may not work as well. The COVID, the virus is also looks like it's quite smart, or it keeps mutating and getting ahead of measures that man is able to put up against it. So it's a kind of battle, but we can be hopeful that things will improve. Just to mention about some of the other disasters, I think the earlier plan of the Voice of Democracy, Lionel, was to address the bigger issues that have happened in Sri Lanka, particularly conflict and war that has caused so many deaths and destruction and displacement. But due to lack of time, I will not go into this aspect too much. But if we do get a chance, or if questions are raised, we can discuss about some other issues there. Or maybe I would suggest that Voice of Democracy can organize a subsequent webinar. Maybe when the COVID condition is brought under control, then we can look at it in a much more in depth and in detail, because I think as we come out of the COVID, this problem is going to be there. And there are many unresolved issues, many simmering problems, and it can't be swept under the carpet. Particularly, we can't continue to have this kind of ethnic conflict going on. I mean, even more recently after the Easter bombing and so on, and even in this COVID response, we see that things, so this kind of ethnic consciousness, ethnic perspective looking at everything from either a Sinhalese or Tamil or a Muslim, or we get into a kind of very constricted point of view, which is not helpful, and it's going to cause more problems. If we can get above this, what we might call the ethnic consciousness. Marxists may call it a false consciousness, or we may call it Maya, until we are able to go beyond that. But unfortunately, even the COVID, look at the burial issues and some of the ways, even with the COVID vaccines roll out. I mean, these issues have to be done in a more professional and sophisticated manner, you might call it. So, and then the natural disaster, the tsunami, is again another disaster that Sri Lanka. So Sri Lanka seems to be facing quite a bit of disasters, and now we have this cargo ship outside the Colombo port that was burning, and now it's sinking. It may not be a direct trauma as such, what we call when it happens, but the long-term consequences, the pollution to the beaches and to the sea life, it's going to have and the livelihoods of particularly the fishermen, and it's going to have a big impact on people, and that's a kind of a long-term chronic disaster. Hopefully the oil spill that people are now worried about will not happen, or maybe not so bad as earlier anticipated, because some of the oil may have been burnt, they are saying, I don't know, but this is a evolving disaster. So just for this quick presentation, and I'll try to go a little bit quickly, I will be using a framework that's well known in mental health, the biological, social, and the psychological, you might call it different dimensions, and it's a helpful way to address any problem that we are trying to understand and address. So it can be the causes can be looked at from these different dimensions, the signs and symptoms that we see, the manifestations can be divided into these, but there's a lot of overlap, and one may influence the other, and also the types of management, the treatment and approaches can be categorized this way. So I'll be using this kind of framework, although I'll be going from one to the other quickly. So there's a lot of accumulating evidence about the mental health consequences of COVID, particularly from countries like US and UK, where the pandemic has really ravaged the whole country, and some studies and surveys and observations have started accumulating. So we have a rough idea what to expect, and also from what has happened in other disasters. So as I mentioned, there are the normal resources, and that Dr. Mahesh also mentioned, and that may be going in cycles when you get a surge in the infections, and then people become used to normal, or at least not normal, but anyway, get about their life. And then again, so there may be cycles that we see. But we may also have to plan for the future and see what may need to be done to help the community recover and get back on their feet. There are well known abnormal consequences that we have to be cognizant of. Pre-existing mental health conditions can get exacerbated. particularly now because of travel restrictions and other people may not be able to get to the clinics or may not be able to get their medications or treatment. Also, people who are prone to anxiety or prone to conditions like hypochondriasis or obsessive compulsive disorders, there may be exacerbations during the stress and the fear that comes from the COVID. They have also shown that there are new mental health disorders that can be directly attributed to the COVID situation, like anxiety, depression, and as mentioned already, and we can see in the discussion also, the pattern of alcohol and drug abuse. So the availability of legal alcohol and drugs may become much more difficult. So there may be, and people have observed, there's a change in the pattern, and people with withdrawal, particularly during, I think, the first wave, the mental health and the medical to deal with severe withdrawal because of the lack of availability. Then there are certain vulnerable groups, particularly the elderly, then our health workers, people who have lost people, the bereaved. So we may need to address their needs also. Then those who have survived the COVID, particularly those who have had to go into intensive care, who may have been on oxygen or ventilators or who had a severe illness, that experience can cause a PTSD. Then there's a condition that's emerging called long COVID. So most people seem to recover, but maybe around 10% may continue to have various symptoms like chronic fatigue and kind of a depressive lack of motivation and myalgias. So these are conditions that are being described, and we may need to be aware of that. I already mentioned about our health workers and frontline workers are under considerable stress and trauma. They have to work sometimes over time, and their needs, and we can see now there's a strike by the nurses drawing attention to their situation. So I think we have to be very careful to look after them and give them the facilities, and their needs have to be met as well. Otherwise, they may not be able to look after us or the others who may have the COVID or have other problems. Due to the long lockdowns and isolations in homes, unfortunately, domestic violence and child abuse have increased. It's reported widely in Sri Lanka, and particularly in the north, where we had many workers are reporting increase in domestic violence and child abuse. The opposite also has happened. Many families have their relationships have improved. They have learned to interact with each other, learn and understand each other, and the family relationships have also improved. So there are positive and negative aspects. And as I mentioned, and as Dr. Mahesh also mentioned, and also in the comments that are coming through, alcohol and drug use patterns, problems have changed. So there may be more illicit use in alcohol use. We have seen home brewing maybe increasing, and drugs also due to availability. Certain drugs may be more used, and also people may be using this as a coping mechanism for being locked down and being isolated. So just the same thing, but looking at it from a individual point of view, individuals, and then I will quickly go through what happens in families and the community. So the COVID survivors, they may have an increased risk of having these many kind of disorders that we already mentioned to some extent. These are the reports from all the studies done in the US. They have a big database now, and the UK and so on, and also in some other Scandinavian countries. So there's a increased risk of maybe a third of people who develop COVID can develop mental health problems. There is some evidence that the virus may be going into the brain also, whether it directly enters the nerve cells or it's a kind of an endothelial capillaries. Still, there are evidence that there is a direct impact on brain, so that some of these psychiatric and mental health problems can be due to, apart from the infection of the respiratory system or other organs. And I have already mentioned some of the pre-existing and what happens in the general population. Now, families, we must also be a little aware that as family as a interacting system, and it's almost a fundamental this in Sri Lankan society, the losses, people who have died or other losses, economic losses, their income has had an impact on the nuclear family and also to some extent the extended family. Although the pattern is changing, modernization, the earlier extended family system is also breaking down. There have been separations, people who have been, particularly those who are overseas, their families have been separated, or due to lockdowns and travel restrictions. We mentioned about strained relationships, particularly being in a small space and family. So a lot of relationships breakdown, domestic violence, child abuse, and of course the socio-economic hardships that Dr. Mahesh referring to, particularly in the daily wage earners and who were dependent on, say, the tourist industry or generally sales. Due to the lockdown, all the shops had to be closed. So these kind of changes have had a big socio-economic impact, which we may need to address as we recover, particularly. And also the long-term lockdowns, people may need something to get along. Their daily wages may not be there, so they may need economic help. The book that I was earlier, the UK has come out with a roadmap to recover from this hardship, and that's just published in April. And one of the important areas that they have highlighted is early brain development of children in homes, particularly due to these lockdowns. And Dr. Mahesh also mentioned about the schools, the preschool teachers and so on. So their brain development can be affected, particularly if there is parental conflict and alcohol and drug use or other maladaptive patterns. The children suffer, and how to make sure that they develop and they get the proper environment that is needed for them to grow into healthy adults. Then certain groups I mentioned, particularly we may need to look at during this pandemic that have been affected disproportionately and may need help in their recovery and eventual healthy life. So the elderly have also faced more morbidity and mortality. They are at a high risk of contacting the COVID and dying, but they have also been isolated and loneliness. There's the studies, neurological studies have shown there's increased risk of dementia. Women have had to the responsibility, the having to run the homes, look after the children more. So the burden on women have been much more. They also have to face the violent husband at home. Various abuses have happened. So I think we have to listen to women's voices more and provide programs and support for them during this time. The youth also is another group, although they may not have been directly affected by the COVID, but their whole future, having to stay at home and having to think about how they are going to earn their living, what is their future occupation, and also their involvement with social media. Some have got over dependent on the social. So they also have some special problems that may need to be addressed. Children, as Dr. Mahesh was saying, because of the situation of being at home and learning online, away from the school environment and facing the home, maybe due to the lockdowns, violence or the abuse there also, and their educational needs. So the children are another group that may need to be looked at especially. Disabled have faced more difficulties. They have been isolated, and they also may need to be looked at. We already mentioned about the health workers. Ethnic groups have faced their own special problems, as I already mentioned. For example, the burial issue, then the lockdowns. But then if we get some time to talk about the effects of the war and what happened, some of these lockdowns and curfews and scarcities have re-triggered PTSD and their memories of what happened. So COVID has also exacerbated the trauma. And then the severely mental ill, as Dr. Mahesh already mentioned, they also the access to medication and treatment. Some of their conditions have been exacerbated, and they also may need to be looked at especially. Now, when we come to communities, so the impact of COVID and all other disasters can be on an individual level, can be on the family level, as we mentioned, or certain groups have been affected differentially, and also whole communities. And in a collectivistic society like in Sri Lanka, I think that's very important to take cognizance, to be aware of that, and to be to address it also. And it's been clearly shown, and even the UK, the roadmap out of COVID, they emphasize that community-based approaches will be much more effective and may give better results in the short and long term. So some of the consequences that can be seen, one is of course the adverse effect of social distancing, being away from the normal social interactions and social networks. This has been called the social vaccine, very powerful. It could have actually stopped the virus in its steps, but unfortunately, guard was down and the virus spread. But being away from people and so on, so it may cause problems when people again try to interact. There may be difficulties and social phobia, and people may not interact like they did before. It's been shown when people go back to work, they may not be able to interact with their co-workers like before. You already mentioned about the shifts in patterns of drug use. Also a phenomena which we can call kind of mass hysteria during severe, when there's a resurgence during this called COVID, the waves, first wave, second wave, third wave, panic buying, hoarding, certain obsessive compulsive behaviors with all the hand washing and cleaning, and there's kind of a fear of people imagine there's a virus floating around, and conspiracy theories that is due to some people are blaming other countries, China, some people are blaming various technological 5G, and or some people say it's doomsday, that this is the end of the world. So this kind of in a context of fear and uncertainty, this kind of mass hysterical behavior can be seen. So I would advocate here very quickly, I think we are coming to the time element, community-based approaches, and we have many manuals that we can use to train and educate community, so our frontline workers, and also perhaps government officers working in, say, the AGA level. There are many officers who can contribute to our COVID recovery program. And some of the skills that can be given are basic psychosocial skills. Is available in both Tamil and Sinhalese. Psychological first aid is another book that's available in all languages, all three languages. And for children and for teachers, there are manuals that we have developed and that are available. And also the approach called the PM Plus, Problem Management Plus, which is approaching the problems that people face. It can be economical, it can be social, it can be mental health. But to address it's a kind of what we call a trans-diagnostic. So instead of the usual mental health approach, you look at the person's problem. And this is a book that has manual that has been produced by WHO and other organizations together, and we have translated and adapted it to our situation in Jaffna, which can be easily, training can be done for grassroots workers, and they can easily, so I think for the COVID recovery program, this will be a very helpful approach that can be done. Just 5 days program is sufficient, 1 week's training. Okay, Suresh, I don't know whether I've run out of time. I have a lot of other slides about various aspects of that we can deal with, and also the more underlying problem of what has happened during the war and so on. But I think maybe I can stop here, and maybe in the question time we can address some of these issues.
Yes, thank you, Daya. That's great. We've got quite a number of questions, and I think we can maybe touch on a number of these issues that I presume you've got some slides on in the discussion and responses to questions. Can I ask both speakers Mahesh to turn on their cameras and unmute themselves. Thank you. And even though these questions have sort of come through both speakers, I'll allow both speakers to have an opportunity to respond. The first question is about the impacts on children, and in particular the restrictions that have resulted in a loss of physical activity, normal play during COVID time, the lack of social interaction due to isolation. Maybe starting with yourself, Mahesh, do you think that this is going to have long-term effects, and what they might be, and how you think it might be that Sri Lanka can address them, both obviously within Sri Lanka, but maybe even more globally?
Yes, Suresh, I think it is going to affect, definitely. The brain development of the child largely depends on interpersonal interaction, interacting with them, with the responding environment. I mean, just watching TV, just watching YouTube, it won't happen. The TV does not respond to the child in a deeper, meaningful way. It is the human interaction that is needed without any doubt, as well as physical activity. Physical activity, I mean, even if the child is doing it alone, that's very important for the brain development. How and why, perhaps this is not the forum to describe. It's crucially important, the physical activity and human interactions. They are significantly curtailed during lockdown. So I don't know how to remedy this. I mean, we can do whatever we can possibly to fill the gap, but I think we have to think in different ways of controlling the COVID, rather than just restricting children to home without allowing them to interact with their peers and other humans.
Yeah, no, great. Thank you, Mahesh. Daya, did you want to add to that at all?
Yes, I think what has happened during the COVID and being, as mentioned, being isolated and away from peers and other children and society may have created a different worldview. And during the recovery, we may need to slowly, it depends on the needs also. I suppose the primary needs is the COVID situation and the risk of the spreading of the infection and so on. But as we come out, there may need to be programs so that it helps the children to get back to school, to be able to interact with others, help them with activities like sports and extracurricular activities. These need to be addressed during the recovery phase.
Thank you. The next question, I'll start with you, and this is a really important and excellent question. It's about the impact on individuals and community, about the guilt and grief of people dying, and about the inability to mourn their deaths in culturally, religiously appropriate ways. This obviously has a very current and strong impact with the COVID situation, but there's also a historical legacy of this inability to mourn. So if you'd like to maybe respond to that initially, and then I'll get Mahesh to comment after.
Yeah, the mourning is a very important need, not only individuals, but even to families and communities. And it may not be appreciated that much. I think we saw this, unfortunately, during the last year with this requirement for burial and so on. In some cultures, burial is very important, but in others, there are other ways of, and the obligation and the responsibility that the person or the family or community feel to the person who has died, and for the proper rituals to be done so that they don't their emotions and their long-term relationships with even the people who have died, but also the people who are living. So all these have to be addressed in a way that people can, people who understand and that they are used to, and it's culturally appropriate. It's very important. And grieving process, we saw it during the war also, and also when people disappear or when the bodies are not available, when things have to be done, or when they're even during the tsunami. So I think in a country like Sri Lanka, it's very important that we give the space and the time, opportunity for culturally appropriate ceremonies and rituals for the grieving process. Otherwise, we may be stuck with a very, not only from the individual grief reaction and pathological grief, but communities also may become resistive and frustrated and angry.
Thank you, Daya. Mahesh, did you want to add to that?
Not really, just, I mean, Prof. Nicely covered it, drawing the parallel to the, persons who are missing and then how the families find it difficult to grieve. That's very important. And we are inducing that right now without any war or, that's kind of a situation in the country. Very sad. It's not only in Sri Lanka and in other countries as well, but I just want to, at this point, now the hospitals have started to create a service where the loved ones can send stuff to people who are in the ward. They are not allowed to go in and visit them, but the security system, can be handed over, maybe food stuff, something to, read or whatever, and they will transport it to the patient inside the hospital. So that's a very good development.
Yeah, no, thank you. That is a good development. Mahesh, you made a very, very interesting comment during your talk about the lower rate of PTSD in soldiers or in the Sri Lankan army compared to other countries. And are you able to elaborate for us why you say that and why you think that might be the case?
Yeah. So it is published research that what they have studied, my colleagues in my department, Professor Ravin Hangwal and Professor Varun Disilla, they have studied the Sri Lankan Navy and the prevalence of PTSD and so many other, suicide rate and so on and so forth. So what they have found is that the PTSD rate is very low. And interestingly, it's even lower among the hardcore military personnel, the special boat squadron, who receive very tough training and who are involved in more traumatic, experiences. They had even lower levels of PTSD. So perhaps the training and the culture of that small unit may have a impact. I mean, we obviously know that, lots of psychological things do operate, social things do operate in causation of mental illness, as Professor Daya Somasunderam explained. The other, it's my hypothesis, we need to explore this. The other possibility is that in the East, people seriously believe in afterlife. So death is not the end for our people. So perhaps, traumatic incidents which cause death anxiety, which is the characteristic causation of PTSD, is not perhaps viewed as that traumatic, not as the end of everything by the people who really believe in an afterlife. That may have played a role.
Daya, did you want to comment on?
Yes, I think we may need to look at some of these studies a little more carefully, because there are other studies, for example, by Dr. Neil Fernando and Ruan Jayatunga, and they were able to study people who were actually involved directly in the conflict, particularly in the poor sector, the north and east, and they showed quite high prevalence of PTSD and depression and other effects, and also in the military hospital where they were in treatment, the effects on the families and use of alcohol and so on. So many of the trauma studies, it may also very important to look at the context under which the study is done and what are the expectations, sometimes even the expectations of the researcher, and how the questions are asked and how the symptoms are looked. And particularly this was found in the United States and UK in the early 80s. There was a general political and perhaps even social in that people who fight or who are in the war or who are military have to be very strong and have to, they don't have any kind of these kind of reactions, and that it's kind of only cowards and people of who are weak may become mentally ill. And I think many of the, even some of the commanders had this view. And also there's a economical aspect also. People who may develop or who are diagnosed with certain mental health problems, then they may need compensation, or they may need to be discharged and given a pension honorably. So there was a lot of pressure against having mental health disorders. So this was clear in the after Falkland Wars in the UK when I was doing my postgraduate studies there, and in the US also. So it took a lot of effort from people who are involved to really bring it on to the general to get the acceptance. And it's only in, I think, DSM-3 that PTSD makes its appearance, and subsequently. So it's a growing awareness, and even the symptoms may not be seen as abnormal, like say having nightmares or having re-experiencing what happened. I think it's normal to remember what happened. And the impacts also may be not seen as PTSD, but maybe alcohol or something like that. So I think we may need to look at how these studies were done.
Yes, I think that's a very valid point, in particular about the different phenomenology that might be culturally driven and modify the presentation and the diagnosis. But whether in fact there might also be protective factors which are culturally driven. There's a question here, Daya, and I'll direct this at you about anti-Muslim sentiments, and in particular during the COVID time, and about how this may have impacted the Muslim communities in Sri Lanka.
Yeah, so I think this is a very important, and it's maybe very difficult to address just straight away, but it's one of the deep underlying problems in Sri Lanka, the whole ethnic issue. And so unless we address these properly, I think we are going to continue to have difficulties, and particularly during the recovery process, if we can get above these kind of ethnic considerations or ethnic consciousness, this whole issue of the burial or cremation had a great impact on the Muslim community, and it was really unnecessary. So against even the best advice from scientific and WHO and other recommendations, and it took a lot of struggle to get that changed. So and to have these kind of thinking patterns, and even the approach of the COVID approach to the COVID pandemic. A very military approach may not be the best for the communities. Our public health sector, our the MOHs and the PHIs and the family health workers are very experienced and very capable. And I think if we can somehow shift the recovery process away from give it into the hands of the professionals who are more capable, and to take not an ethnic perspective, but a more humanitarian perspective, I may call it that, would help Sri Lanka in the long term, not only to solve the COVID. And COVID has given us a real opportunity, I would say, because COVID has not discriminated based on any ethnicity or on any group. It has affected everybody. So if we can come out of it with all the communities together and in a more kind of reconciliation spirit, good. COVID has given us a good opportunity for that.
Thank you, Daya. Mahesh, did you want to comment in particular in Sri Lanka during this time, and might well have some insights into how things have played out on the ground?
Just one comment, that is, we have to be conscious of, this is a conclusion that was drawn from a series of webinars that happened in Sri Lanka, together with some Muslim and Sri Lanka Sinhala groups. They got together and held a series of webinars to explore this and these tensions and the role of the Muslim community, the role of the Sri Lanka Sinhala community, and so on and so forth. So the conclusion, one of the conclusions was that they had to be careful that there are certain elements that might use COVID-related issues to further create a further gap, a distance between communities, between ethnicities. So we have to be very careful. I believe, as a person deep down, people are all in one group and we can live together without any problem. But certain elements, certain forces might use these issues to divide us.
Thank you. The next question is about child abuse and domestic violence, and in particular, whether there might be an underreporting of those types of activities in Sri Lanka, mainly potentially by a fear and a lack of legal protection for victims to come forward, and whether there's a sense that this might well have increased during this time. And I think the sort of important here is about what Sri Lanka might be able to do to promote reporting. And there's also been in here, which I think is a very important point, about institutional abuse, and in particular, religious institutional abuse. Mahesh, did you want to maybe start with that?
Child abuse and domestic violence are issues that have plagued civilization all this time. During this COVID pandemic, we are not entirely exactly sure what's really happening. Has it really gone down or worsened? We are commissioning a study, a very simple, brief one, but we are yet to start that. What we can say at the moment from the experiences or the feedback that I get from people I meet is that there seems to be two patterns. There's a pattern. That is, one is the families which have been anyway functional and they are good to each other. They have become even more functional and less adversity, and they are happier. And the families which were dysfunctional have apparently become, some of them has turned the tide and changed the course of their future, but many of them have become more dysfunctional, more violence, more abuse, and that sort of thing. The institutional abuse, I'm not an expert to comment on that. I think that is something that we need to carefully study and take measures. And these things can be stopped. These things can be prevented. It's not that they cannot be. So, but we have to understand how and why, and not only the legality or the illegality, but the culture within which it happens. And then to change that, to change the norms, which give rise to it, which create a right platform for abuse to happen. The child abuse doesn't happen within a religious institution or within a home overnight. The context is created. The child is further and further disempowered. The consequences of child suffering something negative is further and further considered less important, and then the abuse happens. The physical and sexual abuse happens. By then, the psychological abuse has been happening for a long period of time. So if we understand these correctly and study them properly, we can take steps to prevent them or minimize them.
Thank you. Daya, did you want to add to that?
Yeah, I think generally, I think all over the world, and also in the North and East, I can speak only mainly from North and East, there's been reported, I mean, we don't have any exact figures, but domestic violence and child abuse on one side, and also improvement in relationships and understanding and cohesion, family cohesion has also increased. So this is understandable, being locked up in a small environment and without ability to, or the facility to go out and meet other friends and so on. There's a definite cultural against reporting, and also the facilities available for women or for children for their safety, the attitudes of authorities. There's been a lot of change in the past decade or so, and there are special, now there's a desk, police desk, and there are women officers, and even the judiciary. Earlier, when I was much younger, I can remember even the judiciary and the judges and also very negative attitudes. Even in courts, they can ridicule a woman who is trying to report domestic violence or complain, even in a medical institution. But these have improved. But strangely, in the last 2 years, there's been a kind of reduction in the reporting in some, for example, domestic violence case reporting. So there may be less opportunities, and there may be much more priorities now. And people may be finding it more difficult. We may find it difficult. And I think that issue came up in Australia also, to be able to travel. Particularly if a woman is caught in a domestic violence situation in a home, and there's a lockdown and curfew and so on, then how does she escape? Where can she go? So that also has, so there are, a lot of this is quite a big topic and issues, but there is some improvement over last few years. There are officers now actually dealing with this at the AG level, women development officers, child protection officers, and so on. So mechanisms have been created. I think National Child Protection Authority is there, and the women's, I don't know whether that ministry is still there, but women's ministry and so on. So it's a definite issue, and it needs to be addressed.
And with regards to institutional abuse, if you have any comments about that, in particular, religious institutional abuse?
I don't know whether it's, I really am not able to comment about the impact of COVID. I would expect COVID may have caused some isolation, particularly the elderly have been isolated, and the visits from, but fortunately in Sri Lanka, the family, the extended family or the family looked after the elderly and so on. But they have tended to become more isolated, the ones, particularly the children who have migrated abroad. And if the elderly are left behind in Sri Lanka, they are quite, particularly in the northern east, we find in the north, particularly if I can speak from my own experience, many children are abroad and their elderly parents are at home alone. So then they tend to get isolated and cut off from support during the pandemic and lockdowns and so on. But it's a long-standing problem, institutional children in homes and anyway, I'm not too expert in this.
Okay. So there's an important question here about the reporting, and the comment is that The Economist magazine has noted that maybe the death rates that are officially reported are potentially 3 to 4 times less than the actual death rates. And the questioner is asking about that in reference to Sri Lanka, whether it's a pertinent issue in Sri Lanka, and tied up with the death rates, of course, are the number of actual confirmed cases. Daya, did you have any comments about whether there's a sense that there's an underreporting of death due to COVID? A good example being, of course, in India, where there's quite a mismatch between what was being officially reported and what was being reported officially through funeral parlours and the like.
Yeah, if I may answer that, actually, I think there's definitely a lot of underreporting. This is also generally worldwide, but in Sri Lanka also, I think there are many reasons. Although Sri Lanka has a good reporting system, the system that's been come down from the British times, I would say, of deaths and investigations and the coronal system and so on. But currently, I think, particularly during the first wave and during last year, there are a lot of political reasons also. For example, the elections, and so there was a general this thing that not to report or not to even the PCR testing to investigations, so there is room for improving testing and reporting. I think it has improved now. The actual figures may be a little more reflective of what's happening, but still there are a lot of deaths at home and in the community that may be not reported, but I think the situation has improved.
Okay, there's actually a that's sent through which shows that the rate of testing has decreased, but the proportion of positive tests has increased, which is indicative that in fact there's a problem with testing. I wonder, Mahesh, whether you wanted to comment on that observation.
Tests can never be perfectly done in any country. But the general feeling is that testing is not too bad in Sri Lanka. And I had an image of a graph of the number of tests done. I'll see whether I can trace it now. About the death rate, well, as Professor Somasunderam mentioned, Sri Lanka has a very good reporting system. So, all deaths that happen in the hospital, all patients going to hospital get a PCR done. So everybody's COVID status is known, even if they're admitted to the psychiatry ward. So if any one of them die, we know whether it was a person with the positive PCR test or not. Home deaths, yes, possible, but again, for the corona or for the require to release the body, they generally require a PCR test. So there can be underreporting, but I don't think it's that bad. I think I found that image. Yeah, this is the performance of COVID-19 PCR centers, over time. These are the total samples received, total samples tested, and number of positive samples. So it has been maintained pretty, stable over time. So about 20,000 tests a day. So perhaps not too bad.
Okay. An important issue has been raised about people who might be, because of their work in particular, labourers who might not be able to find work and who might be impacted by the COVID lockdown, being under very severe financial duress and potential increase in suicide rates. Has that been something that's been noted, Mahesh, in Sri Lanka?
Yes and no. Yes to the first part, Suresh, that, it's obvious we can see people, when we drive by to work and all that, drive to work and all that, there are obviously people who do not have, as I mentioned before, who do not have access to internet, who do not have access to online buying, shopping, getting things delivered. And we just imagine you have a one laptop at home your child is using to do online class, and it breaks down. What are you supposed to do? You're not supposed to go out of the house. It's not considered an essential service, and you just can't repair it. The shops are closed. So, and then starving, I'm sure there are people who miss a meal or two in a day because of they do not have enough supplies. So that is sad, but I don't know if it has driven people to suicide. Suicidal attempts are reported to, again, we don't have, countrywide data, but from clinical experience, I would say the deliberate self-harm and suicidal attempts are probably less, not probably, are definitely less. We say less number of such patients these days.
Okay, thank you, Mahesh. Daya, do you think there's any difference in the north and the east of the country to what might be happening in Colombo and the south of the country?
From my own interactions and observations, I think the daily wage earners have been very severely impacted, and even to the point of not having enough food and enough opportunities to. So they need help to survive through this long lockdowns, and also once, even when there are no lockdowns, employment opportunities also have gone down with the change in the whole the way of the tourism, not only the tourism industry, but even regular economic activities, shops and selling and buying, and people also getting involved in the consumer confidence and so on. Also farmers and agricultural sector to look after their and to get access to what they need. Those are all long-term impacts that are going to be telling. I mean, immediately we are worried about the spread of the COVID and how many people are dying and so on. But these are long-term effects that are going to impact on not only the individuals, their families and the community. So we need to see how people who need particularly their daily income or food scarcity needs to be addressed.
Thank you, Daya. Can I ask a question, Mahesh? Maybe I'll address it to you to start with, about vaccination rollout. The way to end this pandemic will be when a good proportion of the population, in particular the adult population, are naked. What would be your comments about the vaccination rollout in Sri Lanka currently?
I think so the main factor that we need to consider here is that that we have not received enough number of doses. That is the bottom line of this, right? I mean, if we had received a couple of millions of vaccines, I mean, it wouldn't have caused so many concerns and unhappinesses and conflicts and so on and so forth. Again, that power-based interpersonal interaction plays a role here. The people who have power, even their staff, their domestic staff have got even the second dose, while family members of certain health workers have not got even one dose. So that problem is there, but I think it is inevitable to some degree in any system when the demand is so huge and the supply is so minimal. But it looks like now China being able to supply many doses of vaccine, perhaps this would ease out. We are still in the first few months of the vaccination program. So I think we have to do everything that is possible to make it better. But I think with time, it will probably, settle down. And we have, as Professor mentioned, we have very good public health system. We have very good system to roll out the vaccines in an organized way. The main problem is that we do not have enough doses.
So we're coming close to the end of our time. Can I maybe ask the both of you to present some summarizing comments? And I'll start maybe with Daya.
Yeah, I think the current crisis that we are facing with the COVID and particularly with the current wave, the surge, is extremely, it's an existential almost crisis for Sri Lanka, and it needs to mobilize all resources to meet this challenge. I think if there's some attention can be paid to some of the lessons learned, and if we can also use the strengths within the Sri Lankan. So one strength is a public health service. I think the whole responsibility and the means has to be given to the people who actually do this. The public health system has worked for so many years and they have so much of experience behind them. Unfortunately, the country is caught in a kind of a military and certain, frameworks of perspectives, and the religious also, the ethnic. So if we can go past that and, approach this as, and the COVID has given us an opportunity in that way to be able to do it in a, non-partisan, scientific, maybe professional way. And if we can really meet the challenge based on that, I think the country will come out stronger and there will be a much more cohesion, and the recovery, the road to recovery will be much more positive.
Thank you, Daya. Did you want to provide some summarizing comments?
Yes, Suresh, thank you. So yes, while agreeing with Professor Somasunderam, I'm going to suggest something perhaps some of you might not really be comfortable with. That is, we have to be, yes, as Prof said, we have to be scientific. I mean, everybody says lockdown is a must. I mean, that's not enough. We have to study, we have to look for the evidence, There may be an association of cases going down with lockdowns, but association alone is not causation. We have to look, we have to use more rigorous methodology and study. And now we have enough, data out there. It has been more than a year since these lockdowns started. So we need to study the lockdowns and their impacts with clear defined indicators, right? Not personal opinions. We have to scientifically study how impactful are the lockdowns and how harmful they are as well. And, lockdown means various levels of restrictions. So which works, which doesn't, which is the optimum. I think we have enough material out there to do this and come up with more scientific conclusions and then plan ahead. One more thing is that, so scientists, doctors can inform the governments the best evidence, the best recommendations. But in the end, the governments have to be answerable to people. So, they are responsible for the economy as well. They're responsible for social well-being as well, social cohesion as well. So I think the scientific recommendations forms a very important basis of actions that the governments have to take. But as all aspects have to be considered in making the decisions.
Thank you, Mahesh. There's a very important and timely comment that's come through in the chat, and that's really about what the diaspora may be able to do to assist Sri Lanka in recovering. I think I would make the comment that the challenges that Sri Lanka faces are no different to any of the challenges that the rest of the world is facing. And I would say that in support of Daya's and Mahesh's comment, that Sri Lanka has an excellent public health system, which, if it was given the resources and the opportunity to do what it does best, would put Sri Lanka, I think, at the forefront of handling or managing the COVID crisis. But maybe for the both of you, is there anything specifically that you think the diaspora may be able to do to assist Sri Lanka's recovery from COVID?
If I go first, because I'm in the scene right now, there are hospitals which are struggling to supply the services due to lack of, certain equipments, like oxygen masks and, connectors and so on and so forth. And there are so many channels that have already been created to help them to link the needy places with people who are happy to part with their money. I'm sure if you look a bit, you can find so many such channels. If needed, I can forward them to you, the organizers, and then you can share with your audience and your usual network. And let me just thank the organizers, which I forgot to do in the very beginning. These are very important, although exhausting 2 hours, but it was exhausting because we were really thinking. We were not just listening and talking. We were made to think. So thank you, Suresh, for excellent moderation, and the viewers' excellent comments, and the organizers for having me. Thank you.
Yeah. Thank you, Mahesh. You're doing my job, because it's been my pleasure and my honour to listen to the both of you, Professor Daya Somasunderam and Dr. Mahesh Rajasuriya, really give us a detailed and insightful set of talks describing the challenges and the issues that Sri Lanka is facing in the COVID pandemic. It's been an excellent set of presentations and an excellent discussion by the panelists. I also thank Ranjit Weerasinghe for looking after the technical aspects of the production today. And finally, thank Lionel Bobagay for hosting this event. And once again, thank you to both Professor Daya Somasunderam and Dr. Mahesh Rajasuriya for taking the time today to share your insights with us. Thank you, audience in particular, and for those in Australia, sleep well, and for those elsewhere, hope that the rest of your day is a peaceful and safe day. Thank you. Goodbye.